I'm Tessa.
And I'm Ryan.
From Jose Brothers Appliance Mattress Outlet. Are you tired of shopping mega stores where the employees don't know the difference between...
Believe them. Would Ballot Measure 44 pay for health care or punish smokers? Find out why people are fired up over smoking. That's tonight on Town Hall.
And now, your host, Jeff Gianola.
Hello, everybody, and welcome to Town Hall. Thanks for joining us tonight. In just a few weeks, you'll vote on Ballot Measure 44, which would raise cigarette taxes to help fund the Oregon Health Plan. How should you vote? And more importantly, who should you believe? Well, by now, you've already seen at least 3 different commercials paid for by the opponents of this measure. Will your vote be determined by 30-second commercials on either side or by hearing both sides of the issue? And that's what we're here to do tonight. That's what Town Hall is all about. In our audience tonight, we have proponents of the measure. We're also going to meet people whose lives have been changed by the Oregon Health Plan. And we'll hear from citizens who oppose this measure. Many oppose the use of cigarettes, but say this measure would do the wrong thing. But we want to tell you right up front, there is somebody missing. This chair was for the paid representative of the No on 44 campaign. Those are the folks who've been running the ads that you've seen on television. The No on 44 campaign is expected to spend up to $7 million on television advertising before you make it to the polls. However, the hired lobbyist who speaks for the campaign refused our invitation to debate this issue on Town Hall tonight. He told our producer the issue was too complicated, that only 4 people in the state understood the measure, and that they were not available. So we're sorry to say that we have an empty chair on Town Hall tonight where that spokesperson for Measure 44 is supposed to be. Let's start off Town Hall. What would Measure 44 do exactly? Well, number one, it increases the tax on cigarettes by 30 cents a pack, a hefty increase. It increases the tobacco products tax. Those are things like chewing tobacco and other tobacco items from 35 to 65% of the wholesale price. And it directs some of the proceeds, the money earned through the tax, to the Oregon Health Plan and to tobacco use reduction programs, with less money going to the general fund. So that's some of the things that it would do. Why is it a good idea on Town Hall? Why is it a good idea? Some quick thoughts. Why a good idea, Measure 44?
I'm a home hospice volunteer worker. 3 of my last patients died from lung cancer. And if you ever watched anybody die of lung cancer, you will vote for this issue. Why
is it a good idea? Why should we vote for this measure? Why?
For the very reasons the gentleman just said. I'm a hospice nurse. I have watched people suffer, not only the patient, but their family who suffers watching that person die.
Why is it a good idea? Let's go to our Town Hall hot seat and tell the folks your name.
Patricia Allison with the Aspire Stop Smoking program. Well, we're obviously going to need the money because what was in the Oregonian recently, the World Health Organization says that by the year 2020, tobacco-related diseases will be the world's greatest killer, causing 1 in every 10 deaths. It's going to be expensive.
We've heard some reasons why you should vote for this measure. The other side, why is it not such a good idea? Who wants to pick up on that? Why is it not a good idea? Go ahead.
Well, first of all, I'd like to point out that everyone is sensitive to the suffering of people who are dying. No one wants to see people dying from cigarette smoke. The question is, what is going to work in our society? And I took a lesson from what happened in Canada when deciding to oppose this issue. Canada tried this same exact thing. They tried to raise taxes on cigarettes, and what it ended up doing was creating a tremendous black market in Canada. It was so bad that 75% of the cigarettes in Quebec and 35% of the cigarettes in Ontario were bootleg cigarettes.
And they were getting the taxes for those?
They weren't getting the taxes. It was causing street crime as people fought for turf. It got so bad that Canada slashed taxes. They slashed taxes because they admitted that the process had failed. They didn't get the revenue, and it caused all sorts of crimes, and it didn't save lives.
Anyone else why this isn't a good idea? Anyone else want to pick up on that? Sure, you right there in the back.
I'm a smoker, and I think it's a bad idea simply because it's not going to work. Raising the price of cigarettes is not going to get me to stop smoking. It's just going to make me mad. And I think this is just an easy way out to pick on an unpopular group in society to foot the bill for everything else.
Okay, well, you've probably seen it. Maybe you got this in the mail. I know I did at my house. It is a letter from a former governor, Vic Atia, here in Oregon. and he has played a very prominent role in the No on 44 campaign. You may have received this letter right here, signed by Mr. Attia, and you've probably seen a commercial that he has been featured in. Let's take a look.
At first, Measure 44 seemed like a simple idea, and I don't smoke, so I won't pay. But when you study the official analysis, you find that most of all the tobacco taxes wouldn't even go to the health plan. And Measure 44 diverts a third of all the money to the general fund to be spent on any programs the legislature wants. Measure 44 has no controls on spending, no controls on administration or waste.
We're going to pick up on some of those issues that the former governor was talking about. We do have to mention that Vic Attia was paid $5,000 for an installment for working on the No on 44 campaign, money that he later returned because of criticism. But let's go on to the larger issue that ad raises. Is it fair to single out smokers with a tax like this? You brought it up as a smoker. Is it fair? You, sir?
No, it's not fair at all. I'm not a smoker. I hate smoking, in fact. But taxes in general are wrong because they take money from one person and they give it to another. If somebody wants to smoke, it's their own business. No one else should prohibit it. It's what they do in their own home. And if someone's going to make the argument that they're going to make someone else pay for their health bills, then we need to fix the health system so that one person isn't forced to pay another person's health bill.
He says it is not fair. It's just not fair.
Linda Bufano, Oregon Nurses Association. The issue of fairness, I think, comes up when the fact is we all pay for people who smoke, whether we smoke or not, and we pay for that out of our taxes. And I'm not even talking about the soft costs of lost productivity due to illness on the job. The fact is we do pay for it. And another thing, as far as the Canadian plan, I'd like to just state that 10% of this tax has to do with prevention, helping people who do smoke to quit smoking, and also prevention for teenagers, who are the biggest number of people who are beginning to smoke and eventually become addicted.
Okay, you're a nurse.
Yes.
Okay, I want everyone to meet another one of our guests, a doctor right here, and go ahead and tell the folks your name.
Yes, my name is Paul Smith. I'm a surgeon. I'm a healthcare advisor for the Cascade Policy Institute.
How are you going to vote on this issue?
Oh, I never met a tax that I like, Jeff. And this one is probably the most regressive and unfair tax that I have ever seen in my lifetime. And we all know this is a tax on poor people, but nobody wants to talk about that. But I would like to address specifically the issue this lady brought up about children. You know, we had 20 years in a row of decreased use of cigarettes by children. And that trend turned around 5 years ago at the same time that we had this great campaign to prevent kids from buying cigarettes in grocery stores and Minute Marts. See, because you take kids and tell them they can't do it, and they're going to do it. And besides that, where are they going to get their cigarettes from if they can't get them legally? They're going to get them from the illegal drug pushers who give them their marijuana and everything else, and you're driving these people away from reason, away from hope, and into the arms of the criminal element that are so appealing to them when they're sort of borderline teenagers.
Oh, who has reaction to what Dr. Smith had to say?
Dr. Minot Cleveland, President of the American Heart Association. Well, in fact, the change in increased prevalence of smoking among teenagers has coincided with a heightened advertising campaign by the tobacco industry. JAMA article, Journal of American Medical Association, a couple of years ago published an article which clearly showed that the campaign in California with the Joe Camel campaign made the Joe Camel figure more recognizable by young, like 5-year-olds, than Mickey Mouse. So we've only been very recently trying to enforce limiting access for people under 18 to get cigarettes. In fact, it correlates exactly with advertising dollars being spent. The most dollars spent for advertising for the 3 major brands are the 3 major brands of teenagers smoking.
Doctor, you have to be in a minority. I mean, you must take a lot of grief for being a doctor and saying, hey, I am against this Measure 44. Have you been?
Well, Jeff, I've never been politically correct in my life. You see, my point is that you cannot, let me back up. The only way you're going to reach people is through reason and persuasion. And once you pull out the guns of government to solve your social problems, you cannot reason with these people. The people that could quit smoking easily have long since quit. The ones who are left, we have to work really hard on, and once we point our guns of government at them, we've lost any hope of discussing things with them.
Kathy Rowland with the American Cancer Society. We know that raising the price of cigarettes through a tax increase is the single most effective way to keep kids from smoking. So if adults choose to continue smoking, that's one thing. Many adult smokers even say that if the price of cigarettes goes up, that's a reason that will dissuade them from smoking. But we know kids are price sensitive and they will quit smoking or not start.
Well, let's go to this gentleman right here. Tell the folks what you do.
Robert Eisinger from Lewis and Clark College.
Oh, Robert, you know, he mentioned regressive tax. What does that mean, regressive tax? This is a regressive tax.
It means that a disproportionate number of the people who are paying for that tax are from the lower economic strata. That's basically what it means in a nutshell. What I'm kind of intrigued by is the argument that persuasion and reason should prevail. So I'd like to ask the two gentlemen who oppose the measure, do you think, in a simple yes or no question, should there be a tax cut on cigarettes?
Should there be a tax cut on cigarettes? Pick it up.
I would say yes. I think that taxes on specific products, when they are related to choice, are wrong. Now, that's a very unpopular position to take. I mean, who wants to defend smokers? You know, but on the other hand, I see a lot of advertisements for Twinkies, and I understand that fat and cholesterol cause a lot of problems in our society. So let's start taxing Twinkies, let's tax obesity, let's tax mountain climbers because they fall in and incur medical expenses. You know, let's take a look at what's really happening here. I'm not a smoker, so I can say this. What's happening is we have a very unpopular group in society, smokers. So these people and others like them are saying, they're politically vulnerable. Let's get them. Let's get them to paramedical bills.
How would you answer that? Our hot seat guest, one we haven't heard from.
I'm Rick North with the American Cancer Society. There is a world of difference between these other products and tobacco. Tobacco is the only product we know that kills when it's used as directed. Secondly, I've never heard of anyone dying from secondhand Twinkies before. It just doesn't happen.
But heart attacks, where do you die from?
The fact is, what we're asking, and we realize that there's a difference here too, because smokers are addicted to tobacco. Over 3/4 of smokers have tried to quit and have been unable to. All we're saying is that with the increased costs that people that use tobacco put on society, both smokers and non-smokers alike, and by the way, in 1993, that was $266 million of direct costs. If you took the total amount of tobacco taxes, even counting Measure 44, it wouldn't even come close to that $266 million. We're simply saying it's a user fee. It's just like if you go camping in a state park, you pay. You pay extra. We're just asking those people
use it, you pay.
who use tobacco, we're just asking them help pay for the increased costs on society that all of us pay.
He says you use it, you pay.
There's a difference between paying for the cost of something and paying for the cost of something plus this punishment that somebody else thinks you should have to pay. I'm not a smoker. I don't smoke. I don't particularly like smoking, but I don't think that putting a tax on cigarettes, a higher tax on cigarettes, is going to stop anybody from smoking at all. It's just going to cost them more.
Punishment.
But if they want to do it, they're going to do it.
I'm Ellen Lowe, Ecumenical Ministries of Oregon, and I'd like to respond to the regressive issue and the concern expressed by some of you for low income. I can't think of any more progressive service for low-income individuals than to have education so their children will not start smoking, and to have cessation programs so they indeed can stop. And most smokers, unlike the gentleman who's here, have indicated that they really wish to stop. This tax, Ballot Measure 44, really is going to be an educational and a financial barrier to tobacco use. That's a service to low-income Oregonians.
So let's go to this gentleman in the back here. We haven't heard from him yet. Go ahead, sir.
My name is Charles Burke, and first of all, I don't believe that cigarettes are addictive. I was a smoker for 20 years plus, and I quit, which was over 20 years ago. So I know that somebody can quit smoking, so I don't believe that it is addictive. Secondly, I think that you cannot regulate anybody's desire to smoke or not to smoke.
You know, Jeff, if a tax would solve our social ills, we would have reached utopia many years ago. And when you talk about addiction, I think what we're really addicted to in this society is the idea that a new tax and a new program, a new government program, will solve our problems and we won't have to worry anymore.
Someone answer that, sir, yeah?
Jeff, Ed Patterson. I'm with the Oregon Association of Hospitals and Health Systems. I'm also on the steering committee for the committee to support the Oregon Health Plan. I want to speak to the fairness issue. And a lot of people here who said it's not a fair tax, most of whom do not smoke, they state. But in the polling that we had done early in this campaign, we found out that fully 1/3 of all the smokers support an increased tax on tobacco to support the Oregon Health Plan. So at least 1/3 of those who consume the tobacco products do support the tax.
How would you answer that, sir?
I own a shop and we sell tobacco products, primarily cigars and bulk tobacco and for pipe smokers. And the ability to pay is further hindered every time we increase a tax on somebody. I mean, you keep jacking it up, and what is the reason? I mean, you're punishing a group of people. Why do this?
This issue of punishment comes up. This issue of punishment, they're saying we're already paying high taxes on cigarettes. Now we're talking about what, almost doubling the tax? We'll run those numbers by in just a minute. It's punishment.
I'm George Stevenson. I've lost 30% of my lungs as a result of cigarettes. I haven't smoked for 15 years, but I'm also a high school teacher, and I continue to hear this business about kids can't make a decision, kids will do this, kids will do that. My experience is if we give good facts, we set good models, and we set a negative image, that a great number of the kids won't start. And anything I can do to pass that message on, that our kids are good, our kids are smart, but we've got to treat them right and give them the message.
Let me ask you a quick question before we go to our first commercial break. Had the cigarette tax in your younger years when you were smoking pretty heavily, had that been a very, very high tax like we're talking about, would that maybe have changed your mind about smoking? Absolutely.
When I started, right after I started smoking, I went in the service where they were 10 cents a pack. It was promoted by the military, it was promoted by the government, it was promoted by the tobacco companies.
Okay, we got a lot more to talk about. We do have to take a break. What about this issue of this tax money? Where will it go? Will most of it go to the Oregon Health Plan? We saw the ads. We heard what they had to say. We'll get down to the bottom of that issue when we come back.
It's coming. Something so big, it will change the way you shop forever. It's the big event at Standard TV and Appliance.
Save now on KitchenAid, Whirlpool, GE, Maytag, Amana, RCA, Zenith, Mitsubishi, and more. Save on washers, dryers, ranges, refrigerators, TVs, and VCRs.
There has never been a sale this big before. The big event, now at Standard TV and Appliance.
There's a place unique in all the world where the air's perfumed and the sea is crystal clear. And it can all be yours with Hawaiian Airlines, Hawaii's flagship airline, winner of 3 international awards for in-flight service and first-class cuisine, daily from Portland starting October 1st. Call your travel agent or 1-800-GO-HAWAII, extension 52, for a free travel planner on Hawaii's Islands of Aloha.
She stood up to protect our families and make our neighborhood safe when other politicians wouldn't even listen. She's Elizabeth Furs. Furs worked to establish anti-gang programs for our young people and programs to prevent child abuse. Furs voted to require that communities be notified when a sex offender moves into a neighborhood. And Elizabeth Furs voted for the crime bill that increases community policing and brought 89 new police officers to our streets and neighborhoods. Elizabeth Furs, making a difference for Oregon families.
Oldsmobile, the official vehicle of the Hood to Coast Relay, is offering great deals on 50 courtesy Bravadas used by the teams and officials. Unlike other four-wheel drive systems, Bravada has no buttons to push or levers to pull. We call it Smart Track. It reacts automatically to changing road conditions, leaving you free to think about other things, like how much money you've just saved on your new Bravada. So hurry into your local Oldsmobile retailer today, because at these prices, the Bravadas are going fast.
On the next AM Northwest, find out 7 bad habits that make you more likely to get sick.
Plus bag lunches you and your kids will actually want to eat. That's Monday at 9.
Well, welcome back to Town Hall, everybody. We're talking about Measure 44, a proposal to nearly double the tax on cigarettes and tobacco. And if you're just joining us, we want to explain why there is somebody missing tonight. This chair was for the paid representative of the No on 44 campaign. The hired lobbyist who speaks for the campaign refused our invitation to discuss the issue, saying the measure was too complicated for all but 3 or 4 people in the state, and they could not be here. And we should look now at how Oregon ranks right now in terms of cigarette taxes. How do we compare? Well, the average tax is 32 cents a pack across the nation. Currently in Oregon, it is 38 cents a pack, so we're right about at the average. If voters pass Measure 44 in November, Oregon's cigarette taxes will be the third highest in the country. Washington State tops the list with taxes of 81.5 cents a pack. Then Michigan comes in at 75 cents per pack. And Oregon would be 68 cents a pack under Measure 44 if it passes. Once again, Oregon's current cigarette tax, 38 cents a pack. That's a lot of new tax money coming in, and they estimate that approximately $150 million worth of taxes will come in the first 2 years if it passes. So where would that money go? Let's stop the tape as we look at one of the No on 44 campaign ads. Listen now for truth and accuracy, and then we'll dissect it.
Measure 44 is out of control. They say it will raise tobacco taxes by 78%. But they don't tell you, most of all the tobacco taxes don't go to the health plan.
The money will not go to the Oregon health plan. Where will it go? That's what the ad says. Is it going to go to the health plan?
Scott Gallant, Oregon Medical Association. In fact, Measure 44 would have 27 cents of the tax go to the Oregon Health Plan, 3 cents would go to the Tobacco Use and Reduction Program. Current taxes, there's a temporary 10-cent tax that goes to the Oregon Health Plan, 22 cents that are not designated general fund, and 6 cents to cities, counties.
So you say this is false, this claim?
That is entirely false.
Okay, let's get another view, and we'll go to Don McIntire joins us. And Don, people know that you're up on these issues, these tax issues. True or false, that ad? It's not going to go to the Oregon Health Plan, the majority of it?
Well, yes, that's true. Not a majority of it is not going to go to the Oregon Health Plan.
That's not correct. Of the new tax, that's not right. Of the new 30-cent tax proposed, 90% of it, 27 out of the 30 cents, will go to the Oregon Health Plan, and 3 cents will go to prevention programs.
Why do you say that's not true, Don?
Well, of the new tax, that's right, but I mean, of a majority.
Okay, that's what we're saying. That's what we're saying.
Got to get to the truth. That's what we're talking about.
All right, but I'm not here necessarily to talk about the distribution. I'm talking about the unseemly fact that we're using taxation to engage in changing social policy. And when we talk about addiction here, I think somebody else mentioned it, but I'll paraphrase it. But one of the things we have to do is end government's addiction to taxes. This is another tax. This takes money out of the private side. I noticed that some of the money that you folks have earmarked for the bureaucracy, I think it's $16 million in the first round, to get bureaucrats to get people to quit smoking. If you really thought that that was going to work, give the whole bunch of it to bureaucrats and that'll end smoking. You know it won't work. It's just another grab.
I want to go to the next part of this ad because it raises some of the points that Don brings up. Let's all pay attention to this and then we'll dissect it. The part of the ad about money spending, let's take a look at it.
It diverts a third of the money to the general fund for the legislature to spend any way it wants, with no controls on spending, no controls on waste.
A third of it going to go to the general fund. Let's go to some gentlemen who know all about where legislative money goes. Tell the folks what you do.
Dick Yates with the Legislative Revenue Office.
Is that true or false, Dick?
Again, you have to deal with the question of what is the effect of the measure versus what is the effect of existing law. The measure increases tobacco and cigarette taxes. All of that essentially goes either to the Oregon Health Plan or to the tobacco use reduction account. But if you look at what total cigarette taxes will be, including existing taxes, after the measure passes, then you're still going to have 22 out of 58 cents going to the state general fund.
How do you feel about that? Anyone here up on that? Go ahead.
Joe Weller with the Cancer Society. It's true, and that 22 cents that's going to the general fund, those decisions were made by previous legislatures for whatever reason. They decided that 22 cents per pack needed to go into the general fund for the legislators to divvy up any way they saw fit. Ballot Measure 44 did not intend to and does not alter the current allocation of money. What it does do is increase the tax by 30 cents allocate 90% to the health plan and 10% to tobacco prevention programs. So all the ads you've seen by the tobacco industry saying otherwise are completely false.
Let's go to Matt Evans, Oregon Tax Research. Matt, how do you come down on this section of the ad?
Well, essentially what Dick said is correct. There is an amount of money that goes to the general fund out of current cigarette taxes and other tobacco taxes. Measure 44 doesn't change the way those taxes are allocated. All it does is bring in a new series of taxes that are allocated specifically to the Oregon Health Plan and to tobacco reduction programs.
Okay, some viewers at home maybe are watching this saying, so what's wrong if it goes to the general fund anyway? Isn't it the legislature's job to spend the money as it sees fit, depending on our needs?
Well, you know, my point is a little different, but I think that the question is whether or not the legislature should have our money. The point I would like to raise with regard to the revenue issue is that my earlier point on the crime and the smuggled cigarettes that Canada has experienced and Washington State experiences now hasn't been addressed by the other side. Let me show you what I pulled out here just as a visual exhibit.
You brought a visual aid there,
yeah,
which
it says,
we may not be able to see.
This is out of the Oregonian. It says Washington may become haven for tobacco smugglers. What happened is their taxes are high, as you showed before.
What was it, 81.5 cents per pack
and
in
so
Washington State?
What people were doing is they were buying cigarettes in Idaho and Oregon, bringing up there and smuggling and selling them on the black market. This is the reason why Canada slashed their taxes. Okay, what we found is that this is proof that the state didn't get the money, that people will get cigarettes from somewhere else, or they'll steal them, or they'll make their own. There won't be more revenue. There'll be a lot more crime. It sounds good, but it's counterintuitive.
Okay, I don't want to get off that subject, but I do want to get back on what we were talking about, which was where will the money go under Measure 44? Where will that go? How will it be allocated?
Jeff, that assumes there's going to be money. You're taking as prima facie that there's going to be money. We're saying it's not going to be there. Every other place that's, maybe not every other place, but most places that have tried this, where there's any significant capability of smuggling, that the money is not there because people circumvent the law.
Jeff, Ed Patterson again, Jeff. And I'd just like to make a statement on the commercial we just saw from the tobacco industry, and it's typical of their whole campaign and has been going on the air for quite a few weeks now, and it's very misleading. The truth is, of the current amount of tax revenue, cigarette tax revenue, fully 80% goes to the general fund, currently, now. If you combine the new tax, only 1/3, or about 31%, will go to the general fund, while the commercial indicates there's going to be more money in the general fund than there was previously. That's an out-and-out fabrication.
Let's get another comment there. Go ahead.
If you really wanted more money to go to health care from cigarette taxes, you would redirect this money that's already going to the general fund instead of putting another tax on top of it and saying, okay, I'm validating this additional tax by putting it to health care.
The legislature takes about $650 million now out of the general fund to help fund the Oregon Health Plan. That part of that is tobacco tax money.
I want to take an information break here. We're talking about the Oregon Health Plan. So the question has to come up, what is the Oregon Health Plan, and how did we get where we are today on the plan? Dan Christopher has a look at that.
This is really one of those history-making days.
Oregon's then-Governor Barbara Roberts celebrated 3.5 years ago when federal officials gave the okay for a bold new health care experiment. The reform plan promised basic health care for 120,000 people who couldn't otherwise afford it. The controversy came from the plan's prioritized list, ranking treatments, which would and which would not be paid for. But by rationing health care, some people were left out. Dee Schnur was one of them. He suffered from chronic back pain, a condition not covered under the rationing plan.
When my back goes to hurting, I am nervous. I can't even write my own name at times.
The plan doesn't pay to treat conditions that get better on their own, or conditions for which home treatments are effective, or cosmetic conditions and conditions for which treatment is generally ineffective, such as advanced cancer. As of January 1st this year, the package does cover 581 conditions and treatments. The plan stresses preventive care. It covers maternity and newborn care, immunizations, all major diseases of women and children, dental services, as well as prescription drugs, hospice care, and much more.
Okay, thank you, Dan. I want to go to this gentleman right now. You come to us with some sort of device.
was a smoker for 40 years, and that's why I have to use this thing. I not only lost my vocal cords, I have to breathe through all of my neck. I have had open heart surgery. I have had aneurysm surgery, and my medical bills up to this point is over $1 million. I don't see the tobacco companies helping pay for that. I also, to get back to the kids, I lecture in the schools on the bad effects of smoking, and what we get off of this measure will help us educate our children, and that's why I say please vote for 44.
He makes a point, Don, that it help educate the children, that it would help prevent smoking in the future. How do you respond to that?
Well, if that is the goal, then let's get it over with and just outlaw smoking. Really, I mean, if this is social policy that we're engaging in, now, for example, I sympathize with...
What was that? The DARE program has been real effective in keeping kids from smoking marijuana.
Repeat that again, Doctor?
I said, or maybe marijuana, because the government programs to keep people from smoking marijuana have been really effective, haven't they?
Typical. I'm Keith Ironside. I'm a pulmonary physician. Spent 25 years taking care of people with lung problems. To answer the question over here, smoking is addicting. It's a terrible disease, but the big crisis is paying for all of the diseases. The #1 cancer in Oregon, the United States, is lung cancer, and a large number of these people, lower socioeconomic, who smoke have lung cancer. Who's going to pay for these people? Where's the money coming from the general fund? It's a crisis.
Jeff,
let's get back to the point, which is it worth funding?
Jeff, that's an absolute lie.
That's a lie.
That's a lie. In actual fact, I hate to say it because it sounds callous, but smokers more than pay for themselves. The fact that smokers die at such an early age,
Let me answer that by
the fact that they die at such an early age saves...
So that's a benefit that they die.
It's not a benefit, but you're talking about money. You're talking about fairness.
Just a second, response from someone.
You know, I'm Pat Cabelay. I'm from the Oregon Nurses Association, and it's hardly just the smoker. If you've ever seen a premature baby delivered prematurely because of smoking, it's an effect on not only the teenagers we're talking about, but on 2- and 3-year-olds who have asthma. This is a real problem for more than just teenagers.
Let's get back to this issue of the Oregon Health Plan. Is it worthy that this money, most of it on the new tax, goes to the Oregon Health Plan? Is that a worthy cause?
I'm a small business owner, and I've got 5 full-time employees, 2 part-time employees, and I can't afford to pay health insurance for my employees, but I have to pay this year $30,000 in taxes already, tobacco taxes. This is on cigars and pipe tobacco. I'd love to be able to take that money and apply it to my employees. The net result of this increase is I'll go to $60,000, but it'll drop off because my sales are going to drop off, and I'm going to probably lay an employee off, and now they'll be on the health plan. This is really good logic.
The financial argument is bogus one. Actually, people who stop buying tobacco products spend their money other ways. It has a far better effect on our economy to spend your money on Twinkies as opposed to spending it on tobacco. So the fact that you're going to lose 1 employee isn't really all that significant. When you look at the effect of what it'll have on the rest of the economy, more employees will be needed.
Okay, we got to take a quick break. When I come back here on Town Hall, you can keep the discussion going behind me, but when we come back, we're going to talk about, some folks say there's a hidden agenda here by both the folks that are for it and for the folks that are against Measure 44. We'll look at that and the issue of big money, millions being spent on this campaign.
What's important to America's families?
You can't do anything without an education these days, but how do you pay for it? That's what I worry about.
And where do the candidates stand? Darlene Hooley opposes cuts in college loans and wants to maintain federal education funding. Congressman Jim Bunn voted to cut college loans by $10 billion and voted to cut billions more in education funding. When it comes to education, there is a difference. Call and find out.
There's one right up in the tree right there.
right-hand side.
Protecting Oregon's forest resources isn't just a good idea.
Say you might want a biologist.
Yeah, we'll probably have to be real careful. That could be a nest tree.
It's been the law for 25 years.
Okay.
There he goes.
The Oregon Forest Practices Act was the first in the nation to safeguard wildlife, fish habitat, and water quality on state and private forest lands. We have some of the toughest forest protection laws in the country. Landowners must tell us before they start harvesting, and they must plant healthy, new trees within 1 year. We're always learning more and improving the Forest Practices Act using the latest scientific research, like we did with our stronger stream protection rules. As Oregonians, we're celebrating a silver anniversary, 25 years of improving forest stewardship.
The all-new, totally redesigned 97 Camry is now at Beaverton Toyota. And to celebrate the best Camry ever, Portland's Volume Toyota dealer is giving you the best prices ever on your favorite Toyotas. Corollas with air, only $12,877 or only $179 a month. And Tacomas are only $99.95 or only $99 a month. And even though we've got lots to choose from, but these prices, you've got to hurry.
You just can't beat Russ Humberston's Beaverton Toyota.
Have you bought a Gold C KATU School Spirit coupon book yet?
What are you waiting for?
Support our schools.
Please buy a book.
The Gold C KATU School Spirit Coupon Book, brought to you by US West, Clackamas Town Center, and KATU Spirit 2. Support education for everyone. Join us for the College Fund UNCF Walkathon Saturday, October 5th at Peninsula Park. Brought to you by KATU Spirit 2 and these sponsors.
So come walk with me, because a mind really is a terrible thing to waste.
Welcome back to Town Hall, everybody. We are talking about Measure 44, the tobacco tax that will be on the ballot. And we do want to start off by saying we had invited the No on 44-page spokesperson to be here tonight, and that is why you see the empty seat. They refused to be on the program tonight to discuss this issue. When we talk about the Measure 44, we're also talking about money spent, millions spent on this campaign. And joining me to talk about that is Channel 2 reporter Jeremy Diesel, who's been investigating and has some facts and figures for us. Hi, Jeremy.
How you doing, Jeff? Well, the opponents of Measure 44 are the ones that are actually expected to spend literally millions of dollars on defeating this cigarette tax increase. Most of that money is going to be spent over the airwaves. Now, the Fairness to Oregonians Committee won't say exactly how much exactly they're planning to spend, but those in favor have a pretty good guess. And that's because this issue is nothing new. Back in 1994, similar measures were on the ballots in both Arizona and Colorado. In Colorado, the proposed tax was 50 cents. The no vote spent $6 million. The result, the tax failed 60 to 40%. Now in Arizona, the tax amount was 40 cents. The $6 million was also spent in that state. That was spent by the no lobby. The result there, the tax actually passed, but it was close, 51 to 49%. That's not all. Back in 1992 in Massachusetts, there was a 25-cent tax increase on the ballot there. A $9 million no effort didn't pay off. The measure did pass 54 to 46%. But Jeff, probably the most interesting is down in California back in 1988. There was another tax increase issue on the ballot. It also passed, but $22 million were spent to try to defeat that measure.
Thanks, Jeremy. Interesting figures, and you have to ask yourself, that much money spent, $22 million, and it goes down to defeat, and a lot of that money coming in from outside Oregon. Does that bother anyone who's against it? Does that bother you at all?
No, that doesn't bother me at all. And I just wanted to bring up another point. There was an argument here about decreasing revenues, and somebody from the pro side said the revenues aren't decreased if you raise the tax. And obviously, their measure isn't working because it's not discouraging anyone to quit smoking. The money's still coming in, and they admitted it during the break.
Don McIntire, does it bother you that so much money coming in from the tobacco companies and some folks would say out-of-state money?
Well, these are political fights, and there's a lot at stake. Now, I understand why the tobacco companies are spending the money. They have a vested interest. I want to remind the listeners here, or the viewers, that the people sitting here opposed to Measure 44, the bunch of us, most of us, I don't think any of us smoke, or maybe there's one or two, but we have no vested interest other in the philosophical issue of taxation. And that is what we want to train this thing on. These people over here may be well-intentioned, but they're trying to modify behavior through tax policy. We look at the government, so hypocritical. There's another socially debilitating thing taking place in Oregon, too, and that's gambling. Government-sponsored gambling, the lottery. Now, if these people are interested in social welfare, they should help us get rid of that addiction by raising taxes somehow on it.
Let's go to the other side, this advertising issue.
Could I make a small comment? One of the things that bothers me about the money that the tobacco industry have is that some of it is coming from my income tax dollars that go to subsidize the tobacco industry.
Let's talk about the millions being spent. Jeremy just showed us what was being spent in other states, what's being spent in Oregon. Does that bother someone on that side?
Jeff, specific about this because this.
Just a second. Go ahead. You have the mic in back there. Go ahead. You don't have the mic. You, sir. Go ahead.
Shane McDermott from the American Lung Association. I think it's insulting to Oregonians that the tobacco industry is trying to buy this election, that they believe that Oregon voters are for sale. They've tried it in other states. This is a clear national strategy by the tobacco industry, and we have to recognize the Fairness Matters to Oregonians Committee is nothing but the tobacco industry.
You wanted to get a comment in.
You know, this is really kind of a Byzantine approach on the other side of this process. There are three very good policy issues here that R.J. Reynolds doesn't want to talk about, and that's what they're trying to do with the $6 million or more that they're going to spend in this campaign. Raising the tax will decrease the number of users, one. Two, the second policy issue is we'll be able to expand the Oregon Health Plan to more poor Oregonians who don't have health coverage. Very important. And the third good policy issue is that we will discourage children from ever beginning smoking. And it does work. It's worked in California, it's worked in Massachusetts, it's worked in every state where it's been implemented.
Money being spent, millions being spent. Let's go to our political professor. Robert, how does that figure out, the millions being spent?
It might bother a lot of people that out-of-state money comes into a particular state to support or oppose a certain measure, but of course there are constitutional questions as to whether or not you could exactly legislate away an outside person to support a measure. So, for example, a person from, let's say, Alabama wants to support a measure in Oregon. If that person from Alabama gave $10 to the cause, we wouldn't say that's a bad thing. When Philip Morris does it, a lot of people say that looks kind of yucky. And the problem is it might look dirty, but I don't have as big a problem with that as maybe legislating that away.
Interesting.
Go ahead. Jeff, excuse me. This is a David and Goliath issue. We're talking about tobacco. That's a $45 billion a year industry who will spend as much money as necessary to make sure that we keep on smoking. And that's where it's from. They don't want to get hit in the pocketbook.
I think we all agree here that smoking is bad. The cigarette tobacco companies started this thing, I don't know how many years ago, and they got a lot of people smoking it, and now we're suffering from it. The thing that we're trying to do here, and we're all talking about it, is taxing us or taxing these people up to the, you know what, because they got it. Well, I won't say addicted, because I think they can quit if they want to.
Okay, I want to talk about something else, and just to be fair, we've showed the commercials for the no on 44, and we've said it seems like there's some sort of hidden agenda. I want to ask the folks who are no on 44, do you feel there's a hidden agenda on the pro 44 side? Anyone feel there's a, you know, they spent $400,000. It's not like the millions of the tobacco company, but they spent $400,000 to qualify it on the ballot. Do you think there's a hidden agenda on their side?
I don't think it's totally hidden. I mean, I'd like to see fewer people smoke myself, but I think they just want to increase the size of government in the Oregon Health Care Plan. And this wouldn't be an issue. We wouldn't be sitting here today if we didn't have a system where one person was forced to pay another person's medical bills. He smokes, I don't. If he smokes, he should cover his medical bills. I shouldn't have to. That's an ethical system. It's unethical to force one person to pay another person's medical bills.
We've established that poor people are smoking today who cannot pay higher insurance premiums or pay their own medical bills. So therefore, it has to be paid by the general
Anyone
community.
think there's a hidden agenda on the other side, a hidden agenda?
I'm not sure it's necessarily a hidden agenda, but I think the impetus is the Oregon Health Plan, which some of us suspect is going to collapse anyhow, and this is probably going to prolong the agony a little bit, but I'm sure that's the motivating force. The money that they're going to collect from the cigarette tax, you'll notice, is not devoted specifically to cardiopulmonary disease. It's going to go into the general fund, it's going to go for the bureaucracy, and into the health plan itself.
Hidden fund, and then we got to take a break. I mean, hidden fund, hidden agenda, I'm sorry.
I need 15 minutes. Mine in Cleveland, Morgan Health,
Right.
From the American Heart Association. I found that I probably now find something I agree with Don McIntire on, which is I would not advocate outlawing smoking, and I doubt that there's hardly anyone on this side who would outlaw smoking. That's not what this is about. I'm a physician who's built his career on health promotion prevention and helping people quit. And coming back to the issue of patients, if you were my patient, I wouldn't tell you what you should do. I would make sure you were aware of health risk, and I would let you know that I would be happy to work with you when you're ready to quit smoking and do everything in my power to do that. I can tell you in terms of the addiction issue, I mean, the overwhelming scientific evidence and the consensus in the medical community is that it is addicting. C. Everett Koop, a well-respected former Surgeon General, says it's addicting as heroin and cocaine. I can't tell you how many veteran patients I've taken care of who said, when I went through the drug and alcohol program, it was harder to quit cocaine, heroin, or alcohol than cigarettes. Finally, I would say on the issue of patients that we bring it back to patients and people trying to quit smoking, and Patricia Allison knows this. It is a tough habit to break, and I can tell you, I've worked with ex-POWs from World War II who survived Japanese prisoner of war camps, some of the toughest, most resilient people in the world, and they've tried and tried, and some of them can't quit smoking. So the evidence is clear that it is addicting.
We're going to have to take a break on that. When we come back, probably the most important issue of all to all of you at home, how should you vote on this issue, Measure 44? Yes or no? When you mark that ballot, we'll be back with some final thoughts. Stay with us.
Over the next 2 weeks, you won't believe what happens to Lois and Clark. They'll risk everything to be together. Then the wedding you thought would never happen, but this time it's for real. Don't miss Lois and Clark. Then, it's the most scandalous movie of the year.
I'm marrying your brother. Don't!
Jenny Garth. 90210. Rob Estes. Melrose Place. A Loss of Innocence. ABC Tonight.
Tonight on KATU Spirit 2.
Oldsmobile, the official vehicle of the Hood to Coast Relay, is offering great deals on 50 courtesy Bravadas used by the teams and officials. Unlike other four-wheel drive systems, Bravada has no buttons to push or levers to pull. We call it Smart Track. It reacts automatically to changing road conditions, leaving you free to think about other things, like how much money you've just saved on your new Bravada. So hurry into your local Oldsmobile retailer today, because at these prices, the Bravadas are going fast.
We bought the business from Jimmy's father. That's why he pushes himself. He doesn't want to disappoint the old man. His back began giving him grief last month. He'd take Advil, plug along, but at the end of the day, it just wasn't enough. So his doctor said to try a leave. Take it every 8 to 12 hours.
Oh, I like that.
Winds up at the end of the day, a leave is stronger relief than a dose of Advil. A leave was all it took. This year, he may even take a day off.
You take enough for both of us.
Aleve. All day strong, all day long.
Sometimes I wonder if these people in Washington live in the same world we do. It's a question of balance. Instead of arguing and going to extremes, they should be working for us. Protecting Medicare is more important than tax breaks for the wealthy. We can balance the budget without cuts in education. And we can do more to create opportunities for working families. Too many politicians are out for themselves. But I know we can do better. And as Oregon Senator, I'll put Oregon families first.
A new day. What's on your to-do list? Isn't it time you had a For You list? Get a Jimmy by GMC. It helps you do the things you have to do. And now with the $1,500 you'll save in your Jimmy SLT, you'll have a little something extra to do some things for you. Like pick up some sticks, polish the new silver, or just get out of town. See your Northwest GMC dealer today.
Welcome back to Town Hall, everybody. We're talking about Ballot Measure 44. You'll be voting on that soon. This is what it would do. It would increase, of course, the tax on cigarettes, 30 cents per pack. What else will it do? It increase tobacco products, other things like chewing tobacco, etc. That tax would go from 35% to 65% of the wholesale price. And it directs some of the proceeds to the Oregon Health Plan, some of the proceeds to tobacco use reduction, and less money to the general fund. That's what it would do. Why should you vote for Measure 44? Some quick, why should you vote for it?
Jeff, Bruce Bishop with Kaiser Permanente, and we support Measure 44 because the fairness that matters to us is providing health care to the uninsured and preventing kids from starting to smoke.
Why should you vote for it?
I'm Frank Baumeister, and I'm president of the Oregon Medical Association, and I'm chairman of the Oregon Health Resources Commission. And I urge everybody to vote for Measure 44. Because number one, it supports the Oregon Health Plan, which is absolutely the most fair approach to providing health care to the indigent that's ever been developed anywhere in Western civilization. The cost of smoking to not only the Oregon Health Plan, but to the medical, to the health of the country in general, is astronomical. I've heard tonight...
Frank, let me just get the other side here because our time's just running out, but that was a good point. Why should you vote no? Why should you vote no?
Why should I vote no?
Why should viewers vote no? We know how you're going to vote.
Not necessarily. Anyway,
Number one reason to vote no.
If this thing passes, maybe all these people who smoke will suddenly quit, and then all this money that the state is expecting to get, it won't be there.
Won't be needed.
Why should they vote no on this? Why should they vote no?
It won't be needed.
I think I could, first of all, I want to remind everyone I don't smoke. I quit smoking after 17 years a long time ago. But I want to ask the audience and everyone else, if they don't think maybe the people supporting Measure 44 are a little bit naive, just ask yourself, what social problem did any tax ever solve? It's what we're doing is we're asking the voters to engage in kind of a self-serving process. Don't tax me, don't tax thee, let's tax the guy behind the tree. Doesn't work.
Okay, final thoughts from two of the spokespeople, and in the time we have left, 30 seconds to tell the viewers why they should vote yes on 44.
I'd like all Oregonians to consider the organizations supporting this plan: the American Cancer Society, the Lung Association, the Heart Association, the Medical Association, the Hospital Association, the Nurses Association, AARP, the Oregon Education Association, teachers, the ecumenical ministries, churches,
League of
Women Voters. Oregon Associated Industry, big business has supported this. Virtually every segment of Oregon society is in support of this, and I would remind viewers, please, if you're still confused after all this, pro and con, think when you go to that polling place, think, who do you trust more? These organizations or the tobacco industry, which is the only group supporting this?
Dr. Smith, why should voters vote no
well,
on this?
I would urge voters to vote no for several reasons. One is I would like to see everyone quit smoking, but I believe that government doesn't work. It doesn't educate our children. It doesn't keep our streets safe, and it won't get people to quit smoking. I submit that if these gentlemen over here were to listen to somebody talk to them about how to quit smoking, they would be much more inclined to listen to me than to these gentlemen on my right. But I'm more concerned as a physician of the moral and ethical dilemma created by this program, which will tie physicians and physicians' salaries to the profits generated by tobacco. It would be like tying your church congregational revenues to a tax on prostitution. I don't think we in the medical profession should be sleeping with the devil.
Okay, those are our final thoughts on that. And we will be right back with Talk Back when Town Hall continues. Stay with us, everybody.
The all-new, totally redesigned 97 Camry is now at Beaverton Toyota. And to celebrate the best Camry ever, Portland's Volume Toyota dealer is giving you the best prices ever on your favorite Toyotas. Corollas with air, only $12,877 or only $179 a month. And Tacomas are only $99.95 or only $99 a month. And even though we've got lots to choose from, but these prices, you've got to hurry.
You just can't beat Russ Humberston's Beaverton Toyota.
There's a place unique in all the world where the air's perfumed and the sea is crystal clear. And it can all be yours with Hawaiian Airlines, Hawaii's flagship airline, winner of 3 international awards for in-flight service and first-class cuisine. Daily from Portland starting October 1st. Call your travel agent or 1-800-GO-HAWAII extension 52 for a free travel planner on Hawaii's Islands of Aloha.
Bob Harris reporting high above Les Schwab's warehouse in Prineville, Oregon. We're here to report one of the largest single tire purchases ever made by an independent tire company, totaling over 500,000 tires. As we speak, they're being trucked to more than 270 Les Schwab Tire Center locations. According to Les Schwab, a purchase of this magnitude means huge savings on premium all-season radials for their customers. In tire savings, it's today's big story.
We're not just in the suit business, we're in the people business. We want you to go the extra mile for your customer. That might mean delivering a garment to a man's home or office. It might mean tailoring a garment in 24 hours. It might mean re-altering a garment if a customer's lost any weight. We're here to offer unparalleled customer service. I guarantee it.
In Lloyd Center, downtown Portland, Clackamas, Beaverton, and Salem.
I buy my new Chrysler LHS because of its size, comfort, and style.
And with my active broadcast schedule, I'm always on the run, so it makes sense to drive something that's comfortable yet sporty. This Chrysler Sebring is just right.
Big or small, we fit them all. Come see our complete line of Chrysler cars and vans at Beaverton Chrysler Plymouth.
America, what a country.
And Chrysler, what a car.
Life may be complicated. Beaver Chrysler Plymouth isn't.
On Canyon Road in Beaverton.
Welcome back to Town Hall. We are talking about Ballot Measure 44, the tobacco tax. What do you think about it? What did you think about our discussion tonight? And what did you think about the fact that the paid spokesperson for the No on 44 committee was not here, refused to be on Town Hall? There is the number to call back, 736-3415. Call it and talk back, and we'll play some of your comments here on Town Hall. Well, do you remember last week's show on Town Hall? We were talking bicycles, and we were talking cars. And we were talking about some of the new bicycle lanes you see around town, including, in some cases, eliminating traffic lanes and giving that whole lane over to bicycles. This is what you said on Talkback.
Automobiles are discourteous to buses as well as bikes of what I have seen in Portland, and it's only getting worse. It's not getting better.
The city of Portland really, really screwed up when they changed Southeast 7th to include a bike lane, and they narrowed the traffic lanes. Traffic was bad enough to begin with. Now it is absolutely horrendous.
Doesn't make any sense at all when there's 10,000 drivers a day on a street like Sandy Boulevard and probably 20 bicyclists.
I have a real problem with all these self-righteous individuals trying to dictate how people will live and what their mode of transportation is. I choose to live 30 miles from Portland, and there's no way that I can go anywhere without a car.
I'm all for sharing the road with bikers, and if they wish to pay for it, all they have to do is start registering their bikes and paying a license fee just as us car drivers do, and that could help pay for the roads.
That was Talkback, and we also received this letter. I have been commuting by bicycle for about 1.5 years. Aside from the obvious health, environment, and budgetary benefits, the most interesting side effect has been that I have become a much better driver. I am a safer and more courteous motorist with regards to all around me. That's from Nick Harridges. Thanks, Nick. And, of course, don't forget, Town Hall is your show, and we do want to hear from you. Next week, in the Town Hall time period, the first presidential debate. You won't want to miss it. And the week after that, Town Hall will have the first U.S. Senate debate with the Oregon candidates for Senate, Tom Bruguiere and Gordon Smith. That's something you won't want to miss. That's Town Hall for this week. Take care, everybody, from all of us here at Channel 2.